Hey manual therapy friends, it's Dr. David here. I'm going to cover with you today on our manual therapy Thursday how to do a C2, C3 opening or up and forward manipulation. This is one of the most common manipulations that I do. It's easy for me, but I know that it's probably going to be hard for you if this is the first time that you're looking at this. I can tell you that I probably spent the better part of a year, I'd say like at least 9 months, practicing this and refining it and getting it to the point where I can do it with my eyes closed. And oftentimes I actually get manipulation to happen before I even thrust. I just line it up right, do all the positioning correctly, and then we'll get a cavitation. Now, at the end of the day, I don't care too much about the cavitation. I care more about the increased mobility. And there's a lot of factors that go into why the joint isn't moving too well, because sometimes it's soft tissue related as far as the muscles, and I think ligamentous can happen as well. You can get adaptations from the ligaments. So you might not get a cavitation. I think the cavitation happens when the cartilage is stuck and it gets freed up quickly and abruptly, and then it makes the pop sound or that little click noise. But it's always cool. It's kind of sexy when you do the technique and you get that reaction from the patient when they're like, oh, I can turn my neck better. And it's kind of miraculous in the moment. But what I can tell you is what I'm going to go into right now is the setup is key. You have to set this up correctly. And your hand motor skills are a big piece of that. So I'm going to go through it kind of quickly. You're probably going to have to rewind this video if you're doing this on a patient or on a friend or something like that, practicing this at home with somebody. But what's required here is you have to know where you're at, obviously. So what I always start with is with my middle fingers, I'm lining up on C2. And then with my MCPs right here, I'm lining up on the facets of C2, C3. I'm sorry, my middle fingers is on the spinous process of C2, spinous process. And then right here, I'm on the facets of C2, C3. So here I am on the spinous process. I'm going to lay my hands up against the facets. And my hands are kind of big. I'm a big guy. So what I have to do on a smaller neck relative to my hands is kind of overlap them more like that to make my hand position smaller. So if I have a really small person on here, I'm almost like that. And a big person, I can only get so far. So I'm overlapped about that much right here on our patient here, on Kevin. All right, so then what I'm gonna do, I'm gonna go through this slowly, distract a little bit. So I lean my body back to distract. Then I'm gonna do the left facet so you can see it better here. Distract, and I'm gonna rotate them to the right a bit, side bend to the left a bit, and then further rotate. And I'm gonna create a flexion moment and wind up that joint. Okay? Let me break it down a little bit differently. That might be easier for you. So you're doing contra or ipsilateral side bending, contralateral rotation, and flexion. The order isn't a huge deal. It's more that you just get to the end point and take up the slack in the joint. And I'm feeling the joint with my fingers as well, so I can feel the tension build up in the joint. That is what took me the better part of the year to feel, by the way. So in case you're like, I don't feel this tension that he's talking about, it's okay if this is your first time or if you're just a few months into this. That's completely normal. You just have to keep going and trying on people. All right, so then once I get to the end range right there, I like to just assess, am I really at the end range? Is it kind of muscular in feel? Is it joint? What am I feeling there? And then I'm looking at the patient too, and I would have screened them already to make sure they're okay with this. We already had a conversation about this. But I'm also looking to see if they're wincing. Usually if it's real stuck, like where it's the main problem that they're seeing you for, they're gonna wince. And you have to make the decision, am I gonna mobilize or manipulate? So I can mobilize from here, just give it nice little wiggles. And if you hang out here for a while, it will free up most of the time. But let's say you wanna manipulate. You okay if I go into this?
Mm-hmm.
So I take up the slack, take it to the end, and give it a little thrust like so. That's all you have to do. You don't have to go super far. Their cheek shouldn't hit the table. It shouldn't be a very aggressive manipulation. If you take up all the slack, do all the setup correctly, all the motions that I went over, you don't need that much more force. The mistake that I commonly see is therapists say, okay, he said side bend, and they go all the way over and rotate this way, and then they unload a bit, and then they give it a big, huge rotation, and they'll often get a cavitation. I mean, something will pop in there, and it gives them that false perception that it was successful. False perception, meaning they pop something, which I think was probably the intent that they had was, I'm going to go pop a neck. But I have to ask, did you really pop C2, C3? Did you increase the mobility at C2, C3? If you knew that it was restricted in up, and that it couldn't go up and forward, it was stuck and down and back, or in other words, it couldn't open very good, it was closed. Did you really hit that, or did you manipulate some other joint? Because there's tons in the neck. So the way that I'm doing it here, I can be very precise and know that I'm doing the exact one that I set out to do. I'm manipulating the exact joint that I set out to manipulate. So you went over it. If you did this with me, we just did the left, you're gonna have to do the exact opposite for the right. So let me just go over that part, and then we'll be done for our manual therapy Thursday. So I'm overlapping on C2 spinous process. I'm gonna side bend him towards the right facet joint here, C2, C3 on the right. Then I'm gonna rotate him away, and I'm maintaining the side bending, and let's flex. Okay, so I have to readjust. That's okay if you need to readjust, because I kind of lost C2. And you could do little minor tweaks here at the end, because I can feel that the joint locks out better here versus here. A little side bending is necessary. Just don't keep them there too long. Now I'm going to actually stand up for this one. I think I'll get better leverage. And notice how far my body's leaning. And then you just give a little extra shove. And that's it. So guys, if you have any questions on this technique, if you have any concerns, I'd love to hear any comments you have. Just comment on the thread here. I'll answer back as the first chance I get. Let me know if you do this technique. This is probably a rarely done technique for physical therapists. Even manual therapists, a lot of them are kind of scared to do it because of the vertebral artery and all the issues for it. Our young studs typically don't have any sort of vertebral artery problem. It's more the older people. There's a whole screening process that we can go into some other day about how to know if this is right for them. And I'll tell you, for me, I use this technique sparingly. I mobilize way more than I manipulate, but if I feel that it's a good situation to manipulate, I go for it confidently. And you just got to talk to your patient about it. Anyways, I hope this was helpful for you. Please comment, let us know if you have any questions, and we'll talk soon. Bye-bye.